My name is Joseph Eduardo, and I've been a patient of Dr. Pigazzi's over the last few months at Weill, Cornell Medicine and New York Presbyterian. I was a lieutenant with the FDNY, and once a year we go for very big physicals, and they said, you're up for the colonoscopy. I didn't have any symptoms, I was healthy, and it was a routine colonoscopy, and I was diagnosed with colorectal cancer. Dr. Pigazzi was one of the only ones that thought that this was much less than what the MRI showed, and he pushed for surgery first before we did any other big treatments, and ultimately he was correct. When I came to Dr. Pigazzi, he was my first opinion after I got the diagnosis, and I went to other surgeons after him. Ultimately, we came back because we felt that his approach was the most thoughtful with respect to my health, my condition, and what my life would be like after surgery also. And we didn't feel like many other places took that into consideration. So after we made the decision to go with Dr. Pigazzi, we felt like a big weight was lifted, off our shoulders. And his staff was great. They always stayed up to date with all of my records, and they wanted records from other hospitals that had done tests. It was seamless. It was seamless. I was out of the hospital 2 days after surgery, and I was home, and it was great. After surgery, post-surgery at home, this type of surgery requires, I think, a lot of knowledge of what happens to your body when you change the colon. And I felt like Dr. Pigazzi's staff was good at giving me information of what to do. If somebody had a similar diagnosis, I would tell them to go see Dr. Pigazzi first, and I would also tell them to do what I did. You should get different opinions about your own particular case. You want to go with someone that thought about your life after surgery, because sometimes that's lost in science or on doctors because they're trying to save your life. So you're looked at as like this patient, which is why I respect Dr. Pigazzi. When you're faced with this diagnosis, it's a scary thing, and one day you don't have it, and the next day you get thrown into this world of cancer. And I would say that you have to be an advocate for yourself, right, as a patient. I mean, that's the way it goes. You advocate for what you think is the right thing, and you get different opinions, but you want to go with the best surgeon. For us, it was Dr. Pigazzi. I just can't thank everybody enough.